Respite care. What is respite care? Respite care is temporary institutional care of a sick, elderly, or disabled person, providing relief for their usual caregiver. Respite care provides relief for the caregiver. In many families, an elderly person is reliant on the care of his or her family. In some cases, this may be a minor amount of care, such as helping around the home. In other situations, the care is comprehensive, involving all levels of personal management. Yet, family members get tired too. They need a break. Sometimes they need help on a day-to-day basis. In other cases, they need someone who can provide care for a period of time while they travel or just take some time to themselves. Respite care workers provide this type of support. Respite workers have the unique ability to help reduce the stress and anxiety that a caregiver has. This may not be all of the time, but it provides an important break for the individual, helping to ensure he or she continues to maintain their mental health. Respite care is flexible. It fits the needs of the individuals involved. That's important because many family members simply do not know there is help available to them. When does a caregiver know when they should consider respite care? It's essential to recognize the needs for caregiver respite support. Simply, no matter the amount or type of service you provided to a loved one, you need a break from time to time. You may simply need to get away, such as due to an emergency or due to another family obligation. However, you should view respite care as a service and support for beyond these times. Recognize the symptoms of needing this type of support. If you are tired and overwhelmed, you may need help. You may feel frustrated or unable to provide the highest level of care to your loved one. You may begin to feel like you are giving up too much of your life to meet your loved one's needs. Or you simply may recognize that you need a day off. Whether your needs are immediate due to another obligation or due to the stress of daily life, it is always a good idea to seek out and use respite care whenever it is available to you. Respite care for Alzheimer's and dementia. Respite care for dementia is very similar to respite care for those who suffer from Alzheimer's disease. The approach to care is different in that they address the individual needs of each patient, but the same because they offer a controlled environment and trained caregivers. Emergency respite. Emergency respite care means the placement of an in-home respite care worker during an unplanned or planned event, or the temporary placement of the care recipient outside the home to substitute for the caregiver. Emergency respite care may be provided on one or more occasions. 6 caregiver qualities. Choosing an in-home caregiver for an elderly relative is an extremely important decision. In this situation, you are looking for so much more than a licensed professional. You want someone who will treat your loved one with the same respect and kindness as you would. It's also important to find a professional caregiver with a personality that will mesh well with your elderly loved ones. There are certain traits that every caregiver should have, such as good disposition, non-argumentative temperament, ability to deal with stress, and overall compassionate nature. The following is a listing of additional qualities to look for as you interview potential caregivers. Number 1, personality. Personality is the single most important quality to look for in a family caregiver, as all of the professional training in the world will not change an individual's attitude. Ask questions that will help you get a sense of a person's compassion, empathy, patience, and selflessness. Some home care patients prefer a caregiver who is chatty, especially if they are particularly lonely or just love to talk. Or the opposite may be true if they prefer a quieter person to spend their time with. Number 2, experience. Another critical quality to look for in a caregiver is experience. This does not necessarily mean you should hire someone with the most experience overall, but rather the type of caregiver who has experience handling needs similar to those of your loved one. Number 3, Training. Both formal and informal training can result in an excellent caregiver. However, if your loved one needs personal care assistance, such as dressing, bathing, and using the bathroom, or even running errands, you should seek someone who is a certified home health aide. It's a good idea for your home care provider to be trained in CPR as well. Number 4, honesty and reliability. Never hire a caregiver without checking their references. You want to verify that the caregiver will neither steal from your loved one's home nor inaccurately portray the number of hours they have worked. You also want to check to be sure the caregiver is known for showing up on time, every time, unless prior arrangements have been made. It's also important to be sure the potential caregiver does not accept gifts from their patients, especially those with any form of dementia. Number 5, accountability. Ask questions that will draw out the potential caregiver's ability to accept personal responsibility for their actions. If you get a sense that they are quick to place the blame elsewhere when things go wrong and do not hold themselves accountable, trust your gut instinct and look elsewhere. Number 6, finances. Unless you are hiring through a home health care agency, you should be prepared to discuss financial payment arrangements with your caregiver. Understand that it is only natural for those providing home care to ask for the pay rate they believe they are worth. And it does not necessarily mean they are in the field just for the money and not for the love of their work. So, if your loved one has declined a senior living facility and would like to receive in-home health care, this list is a great place to start in finding your perfect match.